President Tinubu announces end of state of emergency rule in Rivers State. Nigeria hosts food security initiative, targets $3.1 billion agricultural investment.
I called upon my fellow ministers and leaders from the Sahelian region to deepen our collaboration.
Emerges for brain cancer patients as researchers express optimism over new discoveries. Hello and welcome to the news at 11 on NTNS 24. We're live in Abuja. I am Mina Daniels. President Bola Ahmed Tinubu has announced the official end of the state of emergency in Rivers State. The declaration comes exactly 6 months after the emergency was imposed due to what the president described as a total paralysis of governance in the state. President Tinubu had on March 18, 2025, invoked Section 305 of the Nigerian Constitution to suspend the governor, deputy governor, and state lawmakers following a deepening political crisis between the executive and legislative arms of Rivers State. The conflict left key government functions, including the state budget, completely stalled and sparked widespread concerns over law and order, especially with critical infrastructure like oil pipelines being vandalized. According to the president, recent intelligence reports suggest a renewed willingness among stakeholders in the state to work together and restore democratic governance. Citing a groundswell of understanding and enthusiasm, President Tinubu said the emergency will not extend beyond the original 6-month period and will officially expire this midnight. With the lifting of the emergency, Governor Similaye Fubara, Deputy Governor Ngozi Mma-Odu, and members of the State House of Assembly, led by Speaker Martin Samehule, are expected to resume full duties starting Thursday, September 18, 2025. President Tinubu urged them to put aside past differences and prioritize peace, development, and service delivery to the people of Rivers State. The president also used the occasion to remind all Nigerian governors and state assemblies of the importance of collaboration and good governance. He emphasized that democracy can only thrive in an environment of peace, cautioning against political infighting and urging leaders to place the interests of the people above all. United Nations Children's Fund, UNICEF, has pledged continued support and partnership in actualizing some programs of President Tinubu's renewed hope agenda. Vice President Kashim Shettima describes the move as a step in the right direction, noting that the president has redefined the concept of modern leadership in Nigeria. The vice president stated this when he received a delegation from UNICEF Nigeria, led by the country representative, Wafa Saeed Abdul Latif, on a courtesy visit to the presidential villa. Commenting on the administration's vigor in pursuing legacy projects in health, nutrition, human capital development, and related fields, Vice President Shettima said the government is committed to working with UNICEF and other development to advance some of the laudable initiatives such as Nutrition 774, economic and financial inclusion, and the Nutrition Intervention Fund, among others. State House correspondent Abdulrahman Jibrila reports that the UNICEF country representative, Wafa Saeed Abdul Latif, commended some of the administration's interventions in nutrition, economic and financial inclusion, noting that the government's vision is clear and the mission is realizable. Hand-in-Hand Food Security Initiative under the Food and Agricultural Organization. The Minister of Agriculture and Food Security, Abubakar Kyari, who represented President Bola Tinubu, stated that Nigeria aims to secure $3.1 billion in agricultural investment under the Renewed Hope Agenda. Musa Baba Aliyu reports.
These are representatives from Sahel and West African nations. They are here in Nigeria for the Food and Agriculture Organization's Hand in Hand initiative, which aims to address challenges associated with food and nutrition in the region. Minister of Agriculture and Food Security Abubakar Kyari, representing President Bola Tinubu, says Nigeria is on the right track to improving agricultural activities to meet food demand for export. He calls on other nations in the region to work together and fight a common enemy, hunger.
Therefore, I call upon my fellow ministers and leaders from the Sahelian region to deepen our collaboration. Let us harmonize our policies and share best practices. To our development partners and international financial institutions, we advocate for a more strategic partnership that aligns with our national plans and provides concessional financing and technical assistance for large-scale transboundary water projects.
The FAO country representative for Nigeria and ECOWAS states that the Hand-in-Hand initiative is designed to accelerate transformative, nationally led programs to overhaul agri-food systems, targeting the eradication of poverty, elimination of hunger and malnutrition, and reduction of inequalities.
This is your collective mandate. I challenge you to move beyond project management and become architects of partnership. Proactively engage your governments to create bankable investment portfolios based on the hand-in-hand in evidence.
For years, the West African nations have been battling to eradicate hunger and malnutrition due to climate change, conflict, and unstable governments. Musa Baba Aliyu, NTA News.
Every child has the right to safe and quality health care from the very beginning. This message resonates across the globe today, September 17th, as international community marks the 2025 World Patient Safety Day. Oluse Adeabo reports on how health partners championed by the Ministry of Health and Social Welfare came together to commemorate the day.
According to statistics from Nigeria's Ministry of Health, 1 in 10 patients in the country suffered preventable harm while receiving care. Globally, unsafe healthcare practices results in over 3 million deaths each year.
According to the WHO, millions of patients experience preventable adverse events globally, with infants and newborn being disproportionately impacted.
WHO standards endorsed by member states are improving the quality of care for mothers, newborn, and children, and even the small or sick infants. These efforts are making a difference, but you've still heard what the percentages are. We must do more.
The global conversation experts say must shift from hoping for safety to building safety.
From safe child and postnatal care to immunization safety, infection prevention, and the early recognition of complications, we must ensure that no child is left behind.
Patient safety is no longer an abstract idea. It is a practical imperative, one that we must own, one that we must act on, and one that we must deliver collectively as a country.
The theme for the World Patient Safety Day 2025 is Safe Care for Every Newborn and Every Child. This year's focus highlights the urgent need to prioritize safety in pediatric and neonatal care.
This is World Patient Safety Day.
The day was also marked with an awareness walk where health partners engaged citizens on the importance of meaningful participation in care, especially for children. The commitment aligns with the broader goal of achieving Sustainable Development Goal 3, good health and well-being for all, In Abuja, Olusheye Adiagbo, NTA News.
A team of researchers from Usman Dan Fodio University, Sokoto, strongly believe they have found ingredients that can cure brain cancer. The optimism of the researchers on the efficacy of their finding, overwhelmingly saying it has been tested at a research laboratory in America, with amazing outcome. Hamisu Rogo has more on the story.
It is a landmark research discovery that is sure to please not only the people of Nigeria, but the global community at large. Its key driver is the new thinking current in the country towards a knowledge economy. And the country has been knocking its institutions of higher learning for solutions to many of its challenges of development. And on the evidence of a national exhibition by these institutions held in Abuja, it is clear they have the news to do it with their swag. It is interesting that a woman, Dr. Amina Yusuf Jega, is part of a 5-man team that actually believe they have isolated an ingredient from a common occurrent plant in Nigeria that can cure 5 varieties of cancer. Now, it is a very heartwarming story that in Nigeria and from the laboratories at the University of Sokoto, some group of researchers are coming up with a groundbreaking finding from their pharmaceutical works that have the ability to address various types of cancers. And in fact, it is not about only addressing it, they have put their research finding to test.
And we screened that particular plant first in the US, where we found out that it was able to kill cancer cell lines, especially glioblastoma multiforme, which is the brain cancer. So now, when we got that particular result, we were able to come back home and apply for National Research Funds grants via TED Fund, and it was funded. So we carried out a particular research in screening the plant to see whether we'll be able to come up with the active ingredients that are responsible for the anti-cancer effect of the plant. We didn't just stop there. We tried to screen the plants against different types of cancers like the leukemia, cervical cancer, breast cancer, and what have you. And we were able to go ahead to identify each of the active constituents that are responsible for that cancer, especially the brain cancer, and we test the plant to see whether it will be toxic after long administration. And the toxicity level of the plant was found to be moderately safe.
Oncologists the world over believe that cancers, especially brain cancer, can be very aggressive with a very poor prognosis or period of recovery. And so far, only surgery, radiation, and chemotherapy are available for the treatment of cancers. So what will this new product do differently if it is ready? Have you tested it on human beings?
No, we haven't. This is where we are taking to. But we have tested it in vitro and the activity is very great. And we have tested the toxicity in animals, which is very, very great too.
Key issues pending for this discovery are deepening research and patenting the research product and getting the right pharmaceutical firm that will take over the research discovery. The coming months may be very crucial for this endeavor. In Abuja, Mohammed Hamis Rogo, NTA News.
This is the news at 11 on NTN's 24. We'll take a break now. More reports when we return.
Engineered to perfection, every component is crafted with care, and each design is meticulously tested. From concept to creation, our engineers push the boundaries of technology, seamlessly blending performance and sustainability with a deep commitment to African ingenuity. Introducing the CNG Boss, a remarkable achievement in engineering designed to operate on compressed natural gas, a cleaner and more sustainable fuel alternative. At Innocent Vehicles, we proudly lead the way in creating greener mobility across Africa. And it doesn't stop there. From SUVs to sedans, spacious buses to electric cars, Innocent offers a wide range of models designed to meet every need. Innocent Vehicle, the pride of African roads.
This is NTA News 24.
Thanks for joining us again. The Adolescent Girls Initiative for Learning and Empowerment Agile project in Kogi State has continued the distribution of 40,000 naira conditional cash transfer grants to schoolgirls following the earlier flag-off of the scheme. The initiative is aimed at enhancing school enrollment, retention, and strengthening their contribution to the state's social and economic development. At the exercise held on Wednesday at GYB Model Science Secondary School, Lokoja, the Agile team issued preloaded ATM cards to parents and guardians of beneficiaries. Speaking at the event, the Kogi State Project Coordinator, Mr. Ahmed Oricha, commended Governor Ahmed Usman Ododo for keeping to his promise of ensuring that ATM cards are distributed across the state to all beneficiaries. He stressed that the disbursement was not a one-off, but a follow-up activity towards the governor's pledge at the Agile CCT initiative will be sustained as a continuous intervention under the Agile project. He emphasized that the project would provide a cash grant of 40,000 naira each to 13,359 adolescent girls in transition classes across the state, with the goal of dismantling financial and social-cultural barriers preventing girls from attending school. Oricha further urged schoolgirls to maintain regular school attendance while calling on parents to ensure the funds are used strictly for their children's education. To promote economic growth and financial inclusion, the Central Bank of Nigeria, CBN, has conducted a public fair in Kano to educate Nigerians on ways to achieve price stability in the domestic markets. The event focuses on the use of alternative payment channels to support small and medium enterprises. Awal Salisu reports.
The public fair in Kano, organized by the Central Bank of Nigeria, CBN, serves as a platform designed to bring the bank closer to the people and shed light on policies driving Nigeria's economic growth. With the theme driving alternative payment channels as tool for financial inclusion, growth and accelerated economic development, the event focused on how digital innovations are transforming the financial landscape, especially for small and medium enterprises.
The core objective of this engagement, therefore, is to sensitize members of the public on the bank policies that enhance their lives and livelihood and contribute to the growth and development of the Nigerian economy.
The CBN also introduced the Unified Complaints Tracking System and a USSD code for verifying licensed institutions, reinforcing consumer protection and transparency.
The CBN policy geotagging creates a situation whereby from each location you can tell where a money is being transferred, which is a measure in which you can curb fraud, ensure transparency, and give that confidence to people that are transferring money.
Each and every customer should be given the right of equality, irrespective of the amount of money or the transaction you make.
Participants were encouraged to rely on official CBN platforms for accurate information and to respect the Naira as a symbol of national pride. In Kano, Awal Salisu, NTA News.
Saudi Arabian authorities have released 3 Nigerian pilgrims who were detained in Jeddah a month ago following their arrest over alleged drug trafficking. This was confirmed at a press briefing in Abuja. Salwa Khalil Ibrahim reports.
3 Nigerians, Mariam Abdullahi Bahija Aminu, and Abdul Hamid Sadiq, were recently freed from detention in Saudi Arabia after 4 weeks in custody. They had been arrested on August 6th in Saudi Arabia after a syndicate operating at the Malam Aminu Kano International Airport, Kano, tagged their luggage with illicit drug without their knowledge. They were traveling to Jeddah for the Lesser Hajj when they were detained for alleged drug trafficking. Following complaint from the families, an investigation was launched, leading to the arrest of the drug kingpin and 3 other members of the syndicate, including airline officials. The National Drug Law Enforcement Agency and other government officials engaged with their Saudi counterpart to prove the innocence of the detainees and secure their release.
That following the series of engagements, one of the 3 Nigerians was released from custody on Sunday, the 14th September, and the remaining 2 on Monday, 15th September 2025, just 2 days ago. We'd like to reiterate our commitment that Nigeria will never abandon its citizens, especially when the facts clearly show that they are victims of criminal conspiracies as established in this case. We again assure the public of the agency's unwavering commitment to fight the scourge of substance abuse and illicit drug trafficking in the country with no sacred cows in our enforcement duties.
The detainees are already on their way back to Nigeria. In Abuja, Salwa Khalil Ibrahim, NTA News.
This is the news at 11 on NTN's 24. Here now is a recap of our top stories. President Tinubu announces end of state of emergency rule in Rivers State. Nigeria hosts food security initiative, targets $3.1 billion agricultural investment.
I called upon my fellow ministers and leaders from the Sahelian region to deepen our collaboration.
And hope emerges for brain cancer patients as researchers express optimism over new discoveries.
This is NTA News 24.
Conversation at this year's Joint Scientific Conference of the Nigerian Cardiac Society and the Pan-African Society of Cardiology holding in Abuja is seeking cost-effective interventions for mitigating the burden of managing cardiovascular diseases in Africa. Tokwe Alabi reports that one of the highlights is a basic life support instructor program designed to equip health workers and other citizens with life-saving cardiopulmonary resuscitation skills.
The United Nations set targets to reduce premature cardiovascular disease deaths by 33% by 2030, as out of 17 million premature deaths under the age of 70 due to non-communicable diseases in 2015, 82% are in low and middle-income countries, and 37% are caused by cardiovascular diseases.
To provide feedback to the participating sites.
While most cardiovascular diseases can be prevented by addressing behavioral risk factors, including tobacco use, unhealthy diet and obesity, physical inactivity, and harmful use of alcohol using population-wide strategies, cardiologists believe preventing diabetes and hypertension can also reduce the need for expensive interventions, especially with new data showing that about 4 in 10 Nigerian adults are hypertensive.
People should stop smoking. Stop drinking, should walk a bit more, watch what they eat. We're getting bigger, we're adopting all the foreign lifestyle, drinking all the sugary drinks and everything, even from childhood.
It is very important to understand what treatment is available, what's applied, and what can be optimized.
The idea of the polypill is that you combine all these necessary medicines in one tablet, and therefore the patient just takes one tablet hopefully once a day, and that leads to less confusion, better adherence.
Associated with this is also a lot of cases of sudden death. So as a society, we are really worried about this. We are conducting research. We are providing public health interventions to address some of these challenges.
While Nigeria and Africa are facing increasing cardiovascular diseases, bringing together these experts is expected to address the challenge and impact meaningfully to reduce cardiovascular disease with increased awareness and early detection. In Abuja, Tokwe Alabi, NTA News.
The Director General of Nigerian Television Authority, NTA, Salihu Abdulhamid Dembers, and family members of Ado Dembers have condoled with the Lamido Adamawa Dr. Mohammedu Bokindo Aliyu Mustafa over the death of his brother, Sadana Adamawa, and the former Controller General of the Nigerian Customs Service, Amadou Aliyu Mustafa. Correspondent Mary Adamu George reports that the DG also received condolence message over the passing of his elder brother, Abdulhamid Saidu Dembers, who died recently in Kaduna.
Who spoke on behalf of the Dembers family told the Lamido that they accompanied the DGNT to express their heartfelt sympathy and condolence over the demise of the former Controller General of Nigeria Customs. He described the death of the former custom boss as a great loss not only to the royal family but the entire state and Nigeria at large. He prayed Allah to forgive his shortcomings and grant him paradise. The Lamido thanked the Director General of NTA and the other Dembers family for the visit. The DG and his family members were also at the residence of the district head of Malabo, Aliyu Hamawa Malabo, to also condole him over the death of his uncle Abubakar Chiroma. The DG, who holds the title Sarkin Yaki Malabo, described the death of Abubakar Chiroma as a great loss to Malabo district and the entire Adamawa state. The district head of Malabo thanked the DG for the show of love and wished him well in his endeavors. The Director General also received management of NTA Yola, led by its acting general manager, Habiba Sidi, to condole him over the passing of his eldest brother, Saidu Abdulhamid Dembos, who died recently, and prayed for the repose soul of the deceased and Allah to grant him Al-Jannah Fidausi. A 3-day prayer was held in honor of the deceased. In Yola, Mary Adamu George, NTA News.
And that concludes the news at 11 on NTN's 24. Many thanks for watching. I am Mina Daniels.